In this video, we will cover what is a NG tube, what supplies are needed for an NG tube, the steps for NG tube insertion, how to verify placement of the tube and when verification is needed, complications, and what to do. Our goals. Parents/caregivers will demonstrate pediatric nasogastric tube insertion. Parents/caregivers will demonstrate how to verify placement of a pediatric NG tube. Our objectives. After the completion of this instructional video, the parent/caregiver will be able to apply the steps for inserting a pediatric NG tube, practice the process to verify NG tube placement, identify the supplies needed for NG tube placement, and express any concerns or questions about placing a NG tube. What is a nasogastric tube? A nasogastric tube, also known as NG tube, is a long, thin tube that is temporarily used for medical purposes. The term nasogastric means nose to stomach. The tube passes through the nostril down into the stomach. An NG tube can be used for short-term use. The tube delivers nutrition and also medications directly to the stomach. Supplies needed for NG tube insertion. You will need an NG tube, tape or transparent dressing, a cup of water or pacifier, lubrication, syringe, pH strips, Sharpie, and a stethoscope. Steps for NG tube insertion. Step 1. Gather all supplies, wash hands, and measure the tube length. Tube should be measured from the tip of the child's nose to the earlobe to halfway between the end of the breastbone, where the ribs meet, and the belly button. Mark the length with a Sharpie. The image on the right shows how to measure the tube length. Step 2. Your child might need to be swaddled with a blanket to keep their arms from pulling the tube out while you're inserting. You can swaddle the child's arms down in a blanket or have another person hold the child's arms. Step 3. Take the tip of the NG tube and lubricate it with a water-soluble lubricant. Step 4. Choose a nostril and gently start to insert the tube through the nostril. You should not feel any resistance. Your child might cough or gag during the procedure. You can offer the child a pacifier or a cup of water to swallow and flex the child's head forward, chin to chest. This will help the tube move into the stomach. Step 5. Once you reach the length marked on your tube, stop inserting the tube. Step 6. Lightly tape the tube down, or you can have another person hold the tube until you can verify placement. How to verify placement of the NG tube. Attach a syringe onto the end of the tube. Pull back until stomach contents is in the syringe. Put the contents onto the pH strip. Compare strip color to the color indicator. If pH is 5.5 or less, you are in the right spot. Another way to verify is to attach a syringe with air onto the tube. Put a stethoscope over the epigastric region, above the belly button and below the breastbone. Push air into the tube. If you hear a whoosh sound, you can verify placement. When placement verification is needed. When you are placing the tube, before every tube feed is started, and before medication is administered through the tube. NG placement complications. Look for signs of excessive vomiting or respiratory distress, coughing, choking, or color change. If this occurs, the tube could be incorrectly placed. Remove the tube immediately. The tube also may be placed incorrectly if the pH is greater than 5.5 or you do not hear the whoosh sound while listening and pushing air. Remove the tube if placement cannot be verified. Now you can watch a demonstration video of a pediatric NG tube insertion at home. first thing you're going to want to do is gather your supplies. You'll need an NG tube, some tape, some lubrication, a syringe, a Sharpie, and a stethoscope. Take your NG tube and we're going to measure the length we need to insert. You're going to start at the tip of the nose, down to the earlobe. Then you want to find the halfway point between the end of the breastbone and the belly button. So about right there. Then measure the length of the tube to that point. Then you're going to take your Sharpie and mark the length that you want the tube to go to. That way, when you're inserting, you know when to stop. Take your lubricant and put the tip of the tube into the lubricant. This will help the tube go down the baby's nostril. Now, to keep from baby pulling out the tube while you're inserting, you can wrap the baby up in a blanket. That way their arms are contained and they can't pull. Look and see which nostril you want to use. We're going to use this one. And slowly start inserting the NG tube into the baby's nostril. You can pull the baby's head chin to chest and keep inserting. Find your length that you marked, and when you get to that point, stop inserting. You can lightly tape down the NG tube so that you can verify placement. To verify placement, you're going to take your syringe and pull back air. Attach the syringe to the end of the NG tube. You can unwrap baby so that you can listen for your whoosh sound. Take your stethoscope and put your stethoscope in the epigastric region. That is the same point in between the breastbone and the belly button. Push your air and you should hear a whoosh sound. If you hear the whoosh sound, you know you're in the correct spot. Once you verify you're in the correct spot, you can tape down the NG tube better to the baby's face to make it more secure. And that is it. Now it's your turn to practice NG tube insertion. We will provide the supplies needed for practice along with a practice mannequin. We will help walk you through the steps if you need any assistance.